robot is giving us perfusion. We need better imaging and localization techniques, and this is one example where a lot of development is occurring in the field of radiology and nuclear medicine. Newer and newer models are coming which are actually creating almost replicas of the inside of 3D reconstructions. You can actually have the whole anatomy recreated in the machine, and the beauty is you can incorporate all that data into the robotic system or into your OR's intelligent system. And there is something called augmented reality, which is a technology on the horizon by which you can wear special goggles, and you have the, by press of a button, you can actually import all these images and superimpose them on the patient images. So you are operating on the patient, you press a button, and suddenly the whole CT scan picture comes superimposed on the patient's body. So you know, I'm very close to tumor, I'm away from tumor, there is a vessel which is close by. All these things are possible. So this is all something which is already in the horizon. We need more and more processing of information. We are living in an information explosion era. We need huge computational powers. Each CT MRI machine which is coming is several thousand times more powerful than the previous machine. So this is what is augmented reality. You put on this headgear, you're operating on this patient, you press a button, and you start getting the entire image of inside to see whether the surgery that you are doing is accurate, right, or not. Now this will avoid complications, and this will reduce or remove collateral damage altogether. Another area, scarless surgery. People said, why not we do natural orifice surgery? So put the instrument through the mouth, put the instrument through the vagina. People even tried rectum, but because of infection reasons, that was given up. So you can put the instrument through the vagina, you can put the instrument through the mouth, through the mouth, you go into the stomach, you puncture the stomach, you get your instruments out of stomach into the abdomen, do the surgery, get the specimen into the stomach, close the hole in the stomach, and retrieve. So there is possibility of a transgastric cholecystectomy. You have your gallbladder removed through the stomach, and the gallbladder comes out through your mouth. All that has already been tried. See, a lot of things are tried, experimented. Few of them become useful, successful. Many of them fall by the wayside. So they are forgotten. So that's a process which goes on. These are the various reasons for which we are needing surgery. So the ultimate solution is, can we not avoid disease altogether? Can we not avoid injury altogether? And can we not have a situation where there is no treatment required at all? So we are actually hitting at the very existence of all of us, including you. So that's a food for thought. So why don't we prevent the diseases by doing lifestyle modifications, early detection, etc.? Treatment is just one area, but I think we need to focus on these areas as well. So low-cost gene analysis, use of bioinformatics, lot of use of connectivity, social networking. These are all very, very exciting fields which are going to change. The way telephone changed from this or this instrument to this instrument, today there are hundreds and hundreds of mobile. I'm sure many of you, especially the younger lot, will be using a whole lot of these apps. One of these is this device which you can actually add on to your mobile for blood sugar monitoring, where you don't need a separate sugar monitor. It's a small device. It's already there in the market, which can just fit onto your mobile. There is a stick which comes out. You just make a puncture in the finger. You get some blood, and you just collect the blood there, and the machine displays your value. So your mobile becomes a glucometer also. It's a very small application which is already available. Similarly, there is e-stethoscope available, which you can connect to your mobile. So you put your stethoscope on your precordium, and your entire ECG, heart sounds, all the information about even cardiac output and whole lot of information through the network can be sent to your cardiologist. You don't have to visit your cardiologist. He'll see it there and he'll tell you, koi problem nahi hai, sab kuch theek hai, mast rahiye. Then medical records, most of the places now are going paperless. There's some term called paperless hospital or smart hospital. Smart hospital is a word you will hear very often. It basically means a place where from the point you enter at the gate to the point you exit, everything is under electronic control. You enter, your car number will be read, and the person to whom you're supposed to meet will be notified. Well, this person has already entered the hospital. That kind of a thing, everything. And I'll show you the video at the end, what this concept actually means. It sometimes sounds like fiction, but friends, again, there are numerous hospitals which are almost there, almost close to this situation. And it is said that all the physicians will actually one day stop carrying this stethoscope, will only be carrying that kind of a thing. There are devices now available. Initially, they were made for sports person, but now they're in use where you wear this undershirt or a vest which has got various sensors which can read your heart rate, your blood pressure, your blood glucose level, your temperature, your respiratory rate, and all this can be transmitted to a central station for monitoring by somebody. Now, there are mirrors available. When you're combing your hair or cleaning your teeth or something, it has a sensor which can take all the measurements about your various vital parameters and again store it in a central station. This is all not fiction. All this is there in the market. So all this is going to lead to information overload. If we don't use it properly, we may even reach a stage of breakdown. But our effort should be an intelligent, integrated, converted action to convert it into a breakthrough rather than leading to a breakdown. How has that integration helped us? Now, this is one example. Making paraplegics walk has been a dream of biomechanical engineers for a long time. Huge amount of research is being done. How can we make the paraplegics walk? And now we are very, very close to this, where a chip can be inserted in the brain, and that chip will read the signals from the brain, which will make the artificial skeleton move. Now, this gentleman has an artificial hand, and this movement is occurring secondary to his thoughts. So what has happened is a chip has been inserted. So whatever thoughts are there, the chip picks up those thoughts and converts them into electrical signals which come and carry out those thoughts. Another example where this has been used to enhance human capability. This was used by US Army in several wars. These army men used to carry at least 30 to 40 kilograms of weight on their backs. And they used to have a lot of leg problem. So they developed this exoskeleton which was designed in such a way that when they are walking with so much of load, a lot of load is actually taken off their legs and they don't feel tired at all. Now, this technology was again developed by the US Army. It was used by them, but its clinical application was that they said, okay, why can't we use the same technology for paraplegics? So what they did was, they said, okay, let's try that. Now, this is an example of a lady who's been paraplegic for a long time, and same technology was converted here into a device which helped this paraplegic being able to walk. And this is not controlled by anybody. It's her thoughts from her brain through the chip which are going to this exoskeleton. This young lady had not walked for 19 years, and now with this exoskeleton, it was possible for her to walk. Similarly, nanomedicine or nano surgery or nanotechnology is actually going to remove all of us from the medical scene at all. You will have these small nano robots. All our present robot is going to be absolutely antique. वो तो किसी archives में रखा जाएगा. They will have these tiny nano robots. You inject it into the artery. It will know where the problem is. It will travel through the blood vessel, go there, carry out the corrective surgery, and come and eject itself. Again, sounds like fiction today, but already work is going on. In few years' time, a prototype is going to be out. Now, another very exciting area is what is called use of stem cells, and more importantly, 3D organ printing. Now, the day is not far where if you want, मेरी wife का heart अच्छा नहीं है, वो शायद she doesn't love me enough. I want a very loving wife. Why can't I get her a very loving heart? You go to a shop and you say, Please give me a heart with maximum love for her husband. He says, sir, sham ko le lijiyega. You go, pick it up, and get it changed. Well, one day it may become a reality. So 3D organ printing is another very exciting area. An equally exciting area is artificial organs. Now look at this: bone, skin, pancreas, heart valves, saliva, urinary tract, bladder, cartilage, spinal cord nerves, liver, breast. All these tissues have already been grown in the labs. We are still few years from its clinical applications, but the journey has started. Someday it will lead us there. And finally, I conclude with this 2 minutes video about the smart hospital. This is my last slide. Now this video is produced by Microsoft. Microsoft is working a lot in this technology. She's walking, but she has a sensor which is passing all her vital information to a central database. Now this is a person who's sitting in the central database who's actually monitoring her, and he thought that this person actually needs to have some correction because there was some abnormality. So he just pressed notify patient, and when she reached home, she found that message on her mobile. So just connected to a wall sensor, and she got all the information. She sat down on her drawing room, just pressed that button, and the wall becomes the screen on which the entire information has been displayed. There was a message to her that she needs to see a doctor. So they asked, schedule doctor review. She says yes, and a doctor review has been scheduled. So this is in a remote area in some remote village. She's connected with that. Once she reaches the hospital, this is the hospital where a doctor is actually going to see a patient. He's an endocrinologist. He wants to know how many patients are there, where all should I go. He just switches on his device, and it tells him from where, which route to take in the hospital, how to reach your patient. In the meantime, that patient is already on the way to the hospital. There is a patient in the hospital who needs to take the medicine. This is a smart table. This medicine he had forgotten, which means he has to take. So there was a green circle. This medicine he has already taken. Now this also he has taken. So there is a red circle to tell him whether this medicine needs to be taken. This is all example of a smart hospital where every level, everything you do, there is an electronic device which is monitoring. You need to do a fundoscopy, you just put this instrument, the entire data goes into a central server. You just tell the patient, the notification to the pharmacy goes, and they notify, and the medicines are issued. A robot comes and delivers the medicines to the patient. So like that, this is example of a smart hospital where everything is actually connected to each other in the form of a net. Now this continues. So what is all this leading to? One thing is, patients are now getting more and more empowered. In many ways, it's wonderful, but occasionally we do feel there are some issues by so-called unfiltered information which becomes available. It's enabling the physicians and surgeons to offer better and better care. It's enhancing wellness of the patients, and now there is an attempt at curing the well before they actually get sick. So my last slide, I never think of the future, it comes soon enough. A lot of what I have said might have sounded like fiction to you, but friends, even this surgical robot at one time was a fiction. Everything that we use today at one time was fiction. So who knows what's waiting for us tomorrow. Thank you very much for your time and attention. I don't know if there's time for question, if anybody would like to have any question. Yes, ma'am. It will be a pleasure. Can we have the lights on now? Yes, ma'am.
So we follow a lot of sterile processes when you do nano surgeries. So in this case, how do you manage to sterilize the machine?
The machine has two components. The console, which is away from the patient. There's no sterility. In fact, this is the only surgery which you do without gloves. You're sitting on the console. You are away from the patient. But the part which is close to the patient, the arm, it's covered with sterile drapes. There are sterile drapes which come from the company, and every time we have to use, one of us scrubs and puts these sterile drapes on the arms, which 100% covers the arm. The instruments are autoclaved like any other instrument, and the whole process is absolutely sterile. No other question? Okay. Thank you very much. And once again, sir, thank you so much for the opportunity to be here. It's a unique experience for me. Thank you.
So nice of you, sir. I don't know, actually, I have forgotten the number of years back. It should be, I think, almost 40 years back, when Plaza Cinema was being renovated. For full 1 week, there were series of different films, and I have forgotten the title of the film, which was again a science fiction, wherein they had the fiction. What was that? They had given injection to the surgeon and used him in a very minute form. He was injected. It was injected
like a nanobot.
Like a nanobot, and it was done. And that method was used to clear a clot in the brain. I have forgotten the title of the film, but it was really a very, very interesting film. So that, when he goes through the arteries, there was as if he's going in he's been facing as if in the river, from the high side it's coming. It's like a. So that was a very interesting movie, and yes, again I still remember that 1980 was the year, when at that time I think IVF was in infancy. So that was the time when one of the teachers in our Institute of Rehabilitation Medicine, so he gave that idea, well, this is going to be something of the future. It is actually so. It is very, very popular now. So yes, and really, things cannot work until when the mind perceives. And this is what happens, sir, even for the homeopathic physicians. Until as the doctor perceives what is the real sickness in that person, one cannot do work. Sure. So these are the factors, but I am sorry I have taken the time of the chairperson, who is to who now. Interactive session. So people were thinking as to what are we going to discuss. It's a 30-minute program. She has done a lot of research work on the comparative difference for the medicines which we keep. We are using glass vials mainly for the storage. But she has been working on the use of silica for that. And then she has worked out what is the macrophage activity in vitro. So it's going to be an interesting presentation. And again, it's all keeping with the theme of the Congress. Thank you. Yes. Any questions that will be, they can be done even later, but let us go to the first again, something new. Thank you.
I can. I would like to say thank you to the organization, to this opportunity, and all the efforts they have done to bring me here and give me the pleasure to participate of this great event. My name is Leonie Bonamin. I am from Brazil, São Paulo, from University Paulista. And today I would like to talk some notes about our recent research work in which we did it. We compared the effects of homeopathic medicines prepared in glass and plastic vials using a biological system as a sensor. Use macrophages kept in vitro systems, and these cells are able to respond to several homeopathic medicines, and so we can study the behavior of these medicines using this kind of system. This is previous work. We are starting a new line of research in this subject, so I would like to show some previous results regarding to this theme. I have a student, Luciane Dalboni. She is one of the main author of this work, because it's her thesis to reach the Master of Science degree. And of course, there are other contributors. The idea starts from this statement. There are many studies, recent studies, showing the possible effect of silica nanoparticles that are present in homeopathic medicines, in different kinds of homeopathic medicines, and these little nanoparticles of silica and other substances could participate of the mechanism of action. It's still an hypothesis, but there are lots of people working on this subject. Here we have some papers published about this theme. About the putative participation of silica nanoparticles in the mechanism of action, we have two main hypotheses. The epitaxy hypothesis, that means nanoparticles of silica, if present, would act as an amplifier of specific information to cells as a carrier. So these particles could be able to enter into the cell, into the nuclei, and then to attach the DNA, regulating the DNA expression. This is a structural manner. This is a structural hypothesis. But there are other possibilities. For instance, the field hypothesis. In this case, silica would be a source of electromagnetic microsignals, and it would be able to modulate cell functions using this mechanism. So you don't know exactly what happens, and if silica is so important, so we started to work with this question. Considering the epitaxy hypothesis, the interaction of nanoparticles of the original material, it means the matrix of the medicine, with nanoparticles of silica would be replicated in each following potency during the remedy manufacture, and could be present even in high dilution medicines. It is still a hypothesis. We have to check it, okay? There are very studies that support this hypothesis, but there are other that cannot support this hypothesis. So we have still lots of work to do. For instance, it's an old study from Boiron, in which medicine prepared in vials pre-treated with paraffin were not so able to do their effects as medicines prepared classically using simple glass vials. In 2001, Migrom studied different kinds of glasses to prepare homeopathic medicines with different results using the physicochemical analysis. And against the silica hypothesis, we have other studies. For example, Witt and collaborators in 2006, she could observe that this replication of these nanoparticles along the different dilutions was not true in this case. So it's still a doubt if this multiplication of nanoparticles is always present. And recently, there is the most interesting hypothesis, at least I think so, proposed by Cartwright last year. And it's very interesting because he uses a very simple system using photochromic dyes as a sensor to study modifications in physicochemical properties of homeopathic medicines. And according to his method, these dyes have the behavior of oscillating dipole. So it could interact with water and change its structure because of this, and then it could be observed in a spectrophotometry method because it's a dye. It's a very simple method, very well replicated, and very interesting. It's a very interesting idea because, according to Cartwright, water itself is able to present the same behavior. So even without a specific dye, we could measure this capacity using luminescence models. So according to this idea, the silica is completely outside of the mechanism of action. But all of them are hypotheses. So our objective in this work was to compare the biological effects of homeopathic preparations made in glass and plastic vials to evaluate the putative role of silica in its mechanism of action. It is there is an important point here because in all studies that we can see in the literature about homeopathic effects and mechanism of action and physical-chemical properties, we cannot see the relationship between these physical-chemical properties and biological effect. So we try to join both things with this using this model. So we used macrophage kept in vitro, and our medicine model was arsenicum album in 3 different potencies, 30 Korsakoff, 6 CH, and 200 CH. We did 4 experiments. The first one, we studied arsenicum album in 30 Korsakoff potency. The second, arsenicum album 6CH. The third one, arsenicum album 200 CH. And a fourth experiment, we did some physicochemical analysis of the medicines regarding to the biological effects we have seen in macrophages. All of these medicines were prepared in an authorized pharmacy according to Brazilian rules of Brazilian pharmacopoeia, and all methods was designed to avoid interference in the systems. So the last potency was prepared in sterile millicue water just before the use, was at last moment, and also it was filtered in a microfilter to avoid the possibility of contamination of the cell culture. And
that's also important. Our studies were performed in blind. It's not so common in vitro studies to use this blindness, but here it was very important. So used the raw macrophages. It's a regular lineage of macrophages kept frozen and expanded in RPMI medium. He used